There is a word that is used within the birth community that you may think means a whole lot, but it really don't mean nothing. Hi, I'm Jen. Nice to meet you. I'm a labor and delivery nurse, and I want to tell you about the one word that is going to cause more confusion than anything that you may think helps your team know exactly what you want. And that word is natural. I would like a natural birth. What does that mean to you? Now, natural can mean a whole lot of things to a whole lot of different people. So when you come in and you say to me, I want a natural birth, I'm going to ask you more probing questions to understand exactly what that means. Now, I want to talk to you about what my patients have said that it means to them. And then you can I'm going to try to give you some different vocabulary to use that will help you better communicate with your care team so they know exactly what you're hoping for from your birth experience. So when you come in and you say, I would like a natural birth, I want to tell you about the things that my patients have told me that natural means to them. And then I'm going to give you some better vocabulary in order to help communicate with your care team so they know exactly what you're hoping for out of your labor experience. I've had patients say, I want a natural birth. Sometimes I've had patients say that that means to them a spontaneous labor where we're not being induced. I've had it mean I don't want an epidural. Sometimes that means I don't want any pain medicine. Sometimes that means I want a vaginal birth and not a C-section. Sometimes that means I don't want any interventions at all. Sometimes that means I don't want any medicine in any way, like nausea medicine, pain medicine, anything. So I want to give you some different words, and based on what we're talking about and you feel like you best connect with, these are some words that you can use in order to better communicate with your care team. So the first words that we're going to talk about have to do with how your labor starts and progresses. So if you want a birth or a labor that starts on its own, that is called spontaneous labor. That means that your body goes into labor on its own. Other words to describe ways that labor could start would be an induced labor. Now that would be where we are talking your body into doing something that it is not quite ready to do yet. That is an induced labor, where we're giving you medication or helping you to dilate in other ways when your body has not said it is time to do so yet. Another word that could talk about the way that your labor progresses is called an augmented labor. Now, this is when someone comes into labor on their own, but then their labor peters out. It stalls for some reason or another. And then we can give you medicine to augment your labor to keep you going, progressing in your labor. So those are three words that you can use to help describe the kind of labor that you're hoping for when we're talking about how it starts and it progresses. Now, the next words you're probably very familiar with. Now, this talks about how the baby emerges. The baby is either going to emerge from your loins or through the sunroof. Now, that's called a vaginal delivery or a C-section. Sometimes I've had patients think they're having an anal delivery, where they feel like the baby's coming out of their butthole. I haven't seen that happen yet. I'll let you know. Now, if we're talking about a natural birth, meaning no epidural or no pain medicine, typically the word that is used to describe that is something called unmedicated. Now, unmedicated can get a little tricky too, because some people may hear unmedicated and think no like induction or no Pitocin or no medications at all. But most of the time, an unmedicated delivery means nothing for pain medically. Unmedicated usually means no epidural, but you need to figure out what that means for you. And if it means no pain medicine whatsoever, say that. And then that will help us to know exactly what you're hoping for. Another way that I've heard natural described is a low to no intervention birth. There are so many things that count as interventions. So it's important. Excuse me. I'm so gassy. I'm so sorry. Let me figure out what I was saying. Sometimes when patients come in and they say they want a natural birth or natural labor, what that means to them is a low to no intervention labor and birth. Now, it's important to know what counts as interventions and the interventions that either you would be okay with or not okay with. Some things that count as interventions: IV, fetal monitoring, fluids, antibiotics, like all of these things are interventions. So if you say no interventions, that could mean I don't want you touching me at all. I'm going to birth on my own. But a lot of times what I see people mean whenever they say low to no intervention is like, hey, I'm okay with continuous monitoring, or I'm okay with intermittent monitoring. I just don't want Pitocin or something like that. So if you're wanting a low to no intervention birth, it's important to talk about what you count as interventions and what you count as being okay, because it can get a little tricky whenever we're talking about a no intervention labor and birth, because there are things that count as interventions that maybe you don't count as interventions. I want to talk to you about the dangers of using the word natural as being like morally superior form of labor or birth. Should birth be left alone more? 1,000% yes. Do I think that sometimes in the hospital we create and cause problems? For sure, we do. But there are interventions that are life-saving. And sometimes if we forsake all interventions because we want to be natural, we can find ourselves in situations that we never thought that we'd be in because we made those decisions. So I want to talk to you about the word natural and how nature is morally neutral. So what does that mean? What do I mean whenever I say nature is morally neutral? I mean that nature is neither good nor bad. Nature does not care about an outcome. Nature does not care about our feelings. And unfortunately, sometimes that can cause or end us up in some very natural things that are happening that are bad. Let me give you some examples of some very natural things that can happen that can end in a very, very bad outcome. So let's say that you want a very natural birth, and natural to you means no interventions whatsoever. So maybe you're at the house and your water breaks and you are waiting for labor. But let's say you're waiting for days and days and your labor does not kick in. And 3 days later, you come to the hospital and you have a very natural infection within your womb called chorioamnionitis. Now that can cause both your baby and your life to be in danger. Some other things that could be natural that are obstetrical emergencies would be things like having a cord prolapse where your baby's protective covering breaks, but the cord, the baby's umbilical cord, washes out into the vagina before the baby's head, and that head can cause compression and cause babies to pass away from that, which is why when that happens, it's an emergency C-section. We have minutes to get a baby out, but the treatment, getting a baby out via C-section, is not natural, but the cord prolapse itself is natural. There are so many different examples of this. What I just want you to understand is that nature is not bad. Nature is not good. Nature can be good. Nature can be bad. In the same sentence, we have to say the same thing about hospital interventions. Hospital interventions can be bad, but hospital interventions can also be good. So in saying that one or the other is morally superior, they're not. Nature is morally neutral. Being in a hospital is morally neutral. You're just there to, if anything does need some assistance, that we are able to give that to you. So I want to warn you on just using natural as like a morally superior way of birthing, because that can cause some fear and trepidation in accepting interventions that can be life-saving. Did I get it? I don't know. So if you're hoping for a natural birth, all that really needs to happen is you understand for yourself, what does that mean to you? And when you understand that for yourself, communicating that with your care team is gonna be super awesome, because we can help advocate for you and we can help you to have the birth experience that you are hoping for. So if you are pregnant and you are hoping to have a natural birth, all that I ask is that you figure out, what does that mean to you, and kind of come in with some really descriptive vocabulary so that we can best advocate for you in the things that you want. So are you hoping for a spontaneous labor? Are you hoping for an unmedicated birth with no epidural? Are you hoping for maybe a medicated birth with an epidural, but no Pitocin. So in understanding exactly what interventions are cool and uncool for you and the reasons why, because that also helps me to understand how to best advocate for you. For instance, if you say, I really don't want continuous fetal monitoring because I want to be able to move around. But let's say that something is looking a little weird whenever we check on your baby via intermittent monitoring. And I talk to you about conversation about, hey, we might need to do some continuous monitoring. Understanding that the reason for you not wanting continuous monitoring is because you want to move around can help me to best check on your baby, but also allow you to move around, because there are monitors that, yes, have a leash and hook in, and those are hard to move around in because they got a leash, but there are also wireless monitors. There's monitors that are like a big sticker. So knowing the reasons behind your thoughts and feelings on a certain thing helps me to best advocate for you and to be able to get you the birth experience that you hope for. Man, I forgot to do one of them subscribe things, and I forgot to do a comment thing. Hold on, let me talk about it. For more birth information like this, you can hit the subscribe button, you can like this video, and then you can also hit that bell so that you're notified when your favorite friend of the birth puts something up for you to hang out with me. And while we're talking about this, I think it would be awesome if you told me in the comments, what does natural birth mean to you? I think that's good. Did I do a conclusion? I love how I'm talking to the camera like the camera's going to answer me. Did I do a conclusion? I don't know, but I'll do a quick one. No matter what natural means to you, I wish you the most awesomest birth ever that is informed and empowered and delicious and great. Hold on, I don't like that part. Stop. Back it up. Rewind, freeze. Oh, what was I gonna say? Scratch that. I'm gonna go back and say that again. Okay. So let's talk about some very natural things that can occur in labor and birth that have no interventions at all that cause them, but can end you in a situation that you maybe never hope to be in. Oh my gosh, why am I having trouble talking? What else to say about that?